Balancing your cortisol is kind of like rock stacking. If you add too many rocks, it's going to tumble over. If you don't add enough, it's not a beautiful piece of art. If you don't manage it, you have total chaos. In this video, I am going to show you what this hormone does, how you can test it, what nutrients you can take, and lifestyle changes you can make in order to keep it in balance. Enjoy. Hello everybody, Dr. Brian Desvonick here. If this is your first time watching my channel and you enjoy improving your health and feeling great, make sure you hit that subscribe button and click the bell so that you will be notified of future videos. Cortisol is a steroid hormone known as a glucocorticoid, and it is produced by your adrenal glands, which sit atop your kidneys. Its main jobs are to keep you awake, to prepare your body for stress, and to increase your blood sugar when needed. It also does a bunch of other things, and here's a list. The most common medical condition associated with elevated cortisol is known as Cushing syndrome, and the most common medical condition associated with low cortisol is primary adrenal insufficiency, also known as Addison's disease. You will also read all over the internet about something called adrenal fatigue, which is not technically an established medical diagnosis because it's difficult to objectively differentiate it from other medical conditions. For example, with Cushing syndrome and Addison's disease, there is specific diagnostic criteria, and with these conditions, there is something physiologically broken in the body. I don't like the term adrenal fatigue because it implies that the adrenal gland is tired, which just isn't the case. For healthy folks who are chronically stressed out, we see fluctuations in cortisol. We see it too high or too low at different times, but it's not consistently high or consistently low. It's not due to something being broken. It's basically due to your body's response to environmental stress. And for some folks, their response to stress becomes exaggerated over time with more and more stress in their lives. So for someone who thinks they have adrenal fatigue, or they have been told that they have adrenal fatigue, it's actually code for you are stressed out, and this is your body's response to chronic stress. Life stress affects your cortisol from moment to moment, but life stress does not cause Cushing syndrome or Addison's disease. As I alluded to earlier, cortisol must stay in balance. If it's too high or too low, it's gonna cause symptoms. Here's the signs and symptoms of elevated cortisol. Generally, healthy people who are just dealing with chronic stress won't experience all of these. Mainly, they'll experience abdominal weight gain, muscle weakness, mild to moderate fatigue, irritability, difficulty concentrating, and headaches. The more severe signs and symptoms apply to Cushing syndrome. The main characteristics of Cushing syndrome include increased fat deposits in the abdomen, back of the neck, and face, and high blood pressure. With low cortisol, people may experience these signs and symptoms. Again, folks who are just chronically stressed out may feel weakness, fatigue, low tolerance to cold temperatures, reduced blood pressure, and sleep disturbance. But in Addison's disease, we'll see more of the extreme characteristics like darkening of the skin, other skin discoloration, dark freckles on the face, neck, and shoulders, and extreme fatigue. If you are experiencing any of these signs and symptoms, your doctor may order specific tests to see what's going on with your cortisol. Once your doctor has ruled out other causes of your symptoms, they will order specific tests to see what's going on with your adrenal glands. Usually the first test ordered is the AM serum cortisol. That's first morning cortisol, and the blood is typically drawn before 9 a.m. And if there is any abnormalities in this test, further testing will be done. Since cortisol levels fluctuate throughout the day, high in the morning and low in the night, seeing where your cortisol level is throughout the day is a good idea, and for that we use the cortisol ×4 saliva test. Here's the sample report of the salivary cortisol test. Saliva is collected at specific times of the day, and the results are represented in this graph. For people who are chronically stressed, we'll see abnormalities at specific times a day. Here's a high morning, a high mid-morning, a low mid-morning, a partially inverted curve, a high mid-afternoon, and a high evening. Concerning individuals who are chronically stressed out, we'll generally see 1 point or 2 points that are off the curve throughout the day, as you've seen that I just showed right now. For people who have Cushing's syndrome, we'll see all points will be above the curve, and for people who have Addison's disease, we'll see all points below the curve consistently. If your doctor suspects that you have Cushing's syndrome or Addison's disease, then they will do more testing. So for Cushing's syndrome, we would do a 24-hour urine test, and we would check to see what your level of cortisol is over that time period. And if it's elevated, we would do a dexamethasone suppression test, meaning we give you a hormone to see if it will suppress the production of cortisol. And if it doesn't, it tells us where the cause is coming from. It differentiates between a cause being from maybe a tumor that's on the adrenals versus a tumor that's somewhere else, like maybe in the pituitary gland. For Addison's disease, we would check your morning AM cortisol, and we would check adrenocorticotropic hormone, or ACTH, to see if that is low, because if both your cortisol is low and the ACTH is low, then that would tell us that it's likely due to Addison's disease. Furthermore, we can test specific antibodies to your adrenal gland, because in most cases for Addison's disease, it's an autoimmune condition, meaning your immune system is attacking and destroying your adrenal glands, specifically the part of the gland that makes cortisol. Also with Addison's disease, it's common to see variations in electrolytes, and we could test this with one of the common tests known as a comprehensive metabolic panel. There are pharmacologic and surgical treatments for Cushing's and Addison's. You will not be successful treating these conditions with natural treatments. So just so you know, these are problems of something that's broken in the body, and there has to be either pharmacologic or surgical intervention. However, if your cortisol is abnormal due to chronic stress, then natural treatments are the best thing that you can do. For proper function, the most important vitamins that your adrenals need are vitamin C, vitamin B1, vitamin B2, vitamin B5, and vitamin B6. Also, another important nutrient is tyrosine, because this amino acid is the building blocks of other things that are made by the adrenal glands, namely your adrenaline. Under chronic stress, this neurotransmitter can become depleted in your body, and it's not just needed for adrenal function. Tyrosine is needed for your body to make thyroid hormone, and it's needed for your body to make the feel-good neurotransmitter dopamine. So you get this situation where if you're running low on tyrosine, your body's going to be robbing Peter to pay Paul. It's going to be taking tyrosine from one area to be used in another area, and wherever it's taking from, you're going to have a depletion in there. So it's very important to keep this amino acid elevated in your body, especially during times of stress. Now, you want to make sure that the vitamins and amino acids that you supplement with are in the best, most absorbable forms. For example, you want your vitamin B6 to be in the form of pyridoxal 5-phosphate. And to make things easier for you, I have listed down below in the description several different products which contain these vitamins and amino acids in the best forms. There's also several botanical medications that help with the physical effects of life stress. These include several adaptogenic herbs such as eleuthero, American ginseng, ashwagandha, rhodiola, and licorice. I've provided information about those below down in the description as well. But remember, supplement your diet and lifestyle. The best changes, the most significant changes that you're going to get from any natural treatment plan is the stuff that is the hardest to do. So we're talking lifestyle changes. As mentioned earlier, if you don't have Cushing's or Addison's, the changes in your cortisol function are due to life stress. You can't get away from all of life stress, but you can change how you respond to it, and that is by practicing mindfulness. So I made another video on this topic. The video is how to stop worrying about your health. I'll put a link down in the description so you can check that one out. But basically in that video, I show you technique that you can do to help to deal with life stress and not have the physical reaction to it that you have been having. Next is exercise. Daily moderate exercise will reduce your stress. You just have to do it every day for the rest of your life. I am not kidding. If you are not exercising, even if you're healthy, even if you don't have any stress problems, if you are not exercising on a daily basis, you are doing your body an incredible disservice. Also, if you are not eating well, your body is not being optimized to deal with life stress. So the best diet is one where you make the food yourself. So stop eating out. Who knows what is in that food? Sugar, additives, things to make you addicted, and start making your food from scratch. Don't eat processed food. Anything that's processed is something that has more than one ingredient. So make your food from scratch. Don't eat too often and don't eat too much. Cortisol releases in your body on a day and night cycle. It's basically the hormone that wakes you up in the morning because it's higher in the morning and lower at nighttime. So I've made other videos about how human beings are rhythmic animals. We have to do things in a rhythm. When we get off, it's gonna throw off all the hormones in our body, and cortisol is no exception. So what you wanna do is you wanna make sure that you're setting your alarm in the morning and waking up at the same time every day. Try to go to bed at the same time every day, and try to eat your meals at the same time every day to maintain that rhythm so that your hormones, including your cortisol, stay in a nice balance. If you are one of my patients, or you watch my videos, or you were paying attention to this video 2 minutes ago, you would have heard me say that the most difficult things give the greatest reward. So practicing daily mindfulness, exercising, and eating a good diet and keeping your body in rhythm will give you the greatest benefit when dealing with chronic life stress, and the result is your cortisol will be balanced. In conclusion, stack your rocks like a beautiful piece of art, and when the world knocks them down, put them back up again. If you like this video, consider giving it a thumbs up. If I missed something or you have any other comments or opinions, please put them down below in the comment section. I thank you for watching, and we'll see you in the next one.